Asthma and Air Quality, Northern Illinois University. Asthma is a non-communicable disease that is a major public health concern. Asthma is a chronic disease characterized by recurrent attacks of breathlessness and wheezing. Symptoms of asthma include coughing and wheezing, shortness of breath, trouble breathing, and tightness or pain in the chest. During an asthma attack, the lining of the bronchial tubes swell, causing the airway to narrow and reduce the flow of air in and out of the lungs. The proportion of people in the United States with asthma has grown by nearly 15%, and the American Public Health Association recognizes asthma as one of the leading chronic diseases of childhood. Asthma is also deadly. About 9 people die each day from asthma. 479,300 people have been hospitalized. 1.9 million have had emergency room visits, and 8.9 million have had doctor visits. Asthma has become a public health concern because it has become very expensive. It costs the U.S. $56 billion each year, with an average yearly cost of care for a child with asthma is $1,039. The American Public Health Association and the Centers for Disease Control has several public health concerns that may be important contributors to the onset and severity of asthma. These include smoking, air pollution, poverty-related factors such as poor housing and overcrowding, and lack of access to proper health care. The American Public Health Association and the CDC calls to bring more attention to the disease by increasing personal and public health awareness and educating families and teachers and others that interact with asthmatic children. They have installed watch out for bad air days, and they warn people to avoid pollution hotspots. The CDC launched the National Asthma Control Program in 1999. This is a public health response to control the asthma. The NACP has been working with people with asthma to ensure that they receive care and education to manage their disease. It funds asthma control programs in 34 states, serving 85% of the asthma population. Proper education and care can reduce deaths, hospitalization, missed work, and missed school. How much disease could be prevented through better management of our environment? One way would be to limit the ozone in the air. Ozone is exposure to ambient ozone is a risk factor for triggering acute and chronic health effects or asthma attacks in people with asthma. It is desirable for people with asthma to reduce both short-term and cumulative exposure to ozone. Reducing exposure to ozone will reduce public health impacts. Reduction in traffic congestion will help reduce ozone. A way to reduce ozone in your community would be to enlist local government agencies to sponsor a program for carpooling. There could be cash rewards for the carpooling, and incentives could increase with the increase in miles shared. This would equal less cars on the road. The Air Quality Index is the main function is to serve as an advisory to notify the public when ozone levels are or are expected to be unhealthy. It gives people the opportunity to reduce exposure. EnviroFlash is a system that sends emails about your daily air quality, which can change from day to day and hour to hour. EnviroFlash has formed a partnership between the U.S. EPA and states' local air quality agencies. One way to be more proactive would be to update EnviroFlash. Doctors and medical staff should be required to install the EnviroFlash app on patient cell phones. Doctors should write a prescription for the app so that teachers will have immediate access. The problem with this is that it may not be effective for low-income patients in that they may not have the access to smartphones or computers. The built environment project that I propose would be a solar and wind-powered community center. A solar and wind-powered community center would be a designated clean air location for locals to gather to exercise, play sports, watch plays, or gather and do homework. This community center will cut down the use of dirty energy sources such as oil and gas, as well as raise awareness of energy conservation.